Good day, I am Brian Ramirez, a student nurse from Pamantasang Luzon ng Pasig, and on this video I will discuss about nephrotic syndrome or nephrosis. This is a non-congenital renal disorder. So let's proceed into it. First, what is nephrotic syndrome and what is the definition of it? Nephrotic syndrome is a chronic renal disorder characterized by alteration in the glomerular basement membrane, allowing increased glomerular membrane permeability to plasma protein with remission and exacerbation. Acute phase lasts for 4 weeks. Nephrosis is also altered glomerular permeability, apparently due to autoimmune process or a T lymphocyte dysfunction that results in fusion of glomeruli membrane surfaces, which in turn leads to abnormal loss of protein in urine. So to simplify, or basically the meaning of nephrotic syndrome is a abnormal loss of protein in urine. So the highest incidence is at 3 years of age, and it occurs more often on boys than in girls. So here's the nephrotic syndrome occurs in 3 forms. First form is the congenital as an autosomal recessive disorder, so you can see on the picture. Next is the secondary as a progression of glomerulonephritis or in a connection of systemic diseases. Systemic diseases such as sickle cell anemia or systemic lupus erythematosus or SLE. SLE is one of example is the picture in the middle. Next type is the idiopathic or the primary. The congenital form is rare type of nephrosis, and the idiopathic form is the most common type of nephrosis. So next, how does it occur, or why the nephrosis occurs? Actually, the etiology is still unknown for the nephrosis, but I give some possible causes as I research about the nephrosis. So here are the possible causes. It is said that nephrosis can be inherited by faulty genes or familial from our parent. Next is diabetic kidney disease can also contribute. Next is minimal change disease, focal segment glomerulosclerosis, and membranous nephropathy. So we are going now to predisposing or precipitating factors, or the factors that can also affect or increase the chance of having nephrosis. First is the viral infection, such UTI. May come as part of course of several pathological conditions of the kidneys, such as acute glomerulonephritis is also a condition or disorder for our kidney or genitourinary disorders. So what are the manifestation or what are the signs and symptoms of the disease? So the symptoms are, first is the excessive proteinuria causing the urine to be dark and foamy and cloudy. So having a protein on our urine gives these characteristics, as you can see on the picture: dark, foamy, and cloudy urine. Next is hypoproteinemia. Because of loss of the protein through urine, the serum of protein become low on our blood. That's why there is a hypoproteinemia, and we will discuss it more further for next slides. 3. Decreased urine output or oliguria, or cessation of urine. Next is microscopic hematuria, or presence of blood on the urine. And next is susceptibility to infection. Next on our manifestation, There could be a severe generalized edema or anasarca. It could be a pitting edema or edema that is present on the legs of our client, or edema like what you see on the picture, uh, the edema on the face or puffing of the face. And this puffing face on the nephrosis usually occur during every morning. Number two is insidious weight or loss of weight, one of the manifestation. Normal blood pressure, but on nephrosis, we have to monitor always the blood pressure of our client, and I will explain it more further on the next slides. Anorexia, pallor, and fatigue are also signs and symptoms. So next slide is the diagnosis. I'm sorry. First, next line is the diagnosis. First is the urinalysis, which is determining if there is a protein on the urine. So, having a so much protein on the urine can be a positive to nephrosis with the support of complete blood count. And how do complete blood count support it? And we said earlier on the manifestation, let me go back here, there is hypoproteinemia or the low serum protein on the blood. This is what is we expected a result on the complete blood count of a nephrotic or a person who having a nephrosis. So the diagnoses are, again, urinalysis and CBC. Next, on our nursing management, it is divided on dependent, independent, and interdependent nursing management. But I only manage giving independent and interdependent management, nursing management, because the condition needs a professional hand, and I can find any dependent nursing intervention here. So we'll proceed on the independent. First thing to do initially is to maintain complete bed rest, ambulate gradually after the acute edematous phase. Next is to monitor vital signs, including BP, every 2 hours. As we said earlier in the signs and symptoms, the BP is normal, but any alteration become increased or lowered, it could affect the nephrosis and could lead to more serious problems. Next, give meticulous care for edematous skin uh, by changing the position every 2 hours to prevent uh, pressure ulceration of the skin, and provide support to edematous scrotum. Use Socratal support, and no band-aid on edematous skin because it is more prone on having scratch or lesions, and a simple band-aid can cause that. Next is to meet psychological need and provide health teaching. Next, on our interdependent function, or also known as collaborative function, provide proper diet by offer small frequent meals, give a no added salt diet during acute edematous urine, give a high protein, high carbohydrate diet unless there is a renal failure or azotemia in such case, and maintain a low protein diet. And for us to be sure, we can consult to a dietitian. That's why I put it into interdependent management. Next is to provide medication. The medication that should be provided are to administer corticosteroids or the oral prednisone. This is the usual treatment for the nephrosis. And if our client is do not respond to steroid, or whom that steroids are contraindicated to them, we can give immunosuppressants as their medication. And I will discuss it more later. Next is the contact renal service. So let's proceed on the next slide on the medical management, medication, surgery, or laboratory procedure. On the on the medications, steroid, corticosteroid, or oral prednisone, as I said earlier, and cyclophosphamide is also a steroid, is an example of steroid. And as I said earlier, if the our client is do not respond to steroid, or whom or the client is contraindicated on steroids, we can give immunosuppressants, antidiuretic drug for the edema, and antibiotics to avoid infections. So next, for the medical management, surgery. And I only found one surgery because nephrotic syndrome does not need more uh, this kind of intervention, because nephrotic syndrome can be cured through the use of medication. So the only surgery, maybe if the condition becomes more severe and severe, and that's why we have to give implement a renal transplant. So on the complications, uh, the book does not provide complication, and so I search for the possible complications of having a nephrotic syndrome, and this is what I've got: acute renal and renal vein thrombosis. Because of the edema and the presence of proteinuria, there could be a thrombosis which could block the um, blood vessels. Next is atherosclerosis and related heart failure, chronic kidney diseases, fluid overload, congestive heart failure because of the edema present, or the anasarca or the pulmonary edema. Next is the infection including pneumococcal pneumonia. A the children who having a nephrotic syndrome has the highest incidence of pneumococcal, a high um, chance to have a pneumococcal pneumonia. Thank you for listening, everyone. I hope you enjoy and you learn of what I reported on this video. Thank you so much.